Vaccination is for sheep. And if you don't get vaccinated, you may not play in the NFL. Ooh. But who's the good side? Who's the bad side? What side am I on? So we're going to do both sides. Let's play devil's advocate. Vaccination, no vaccination. So haters, lovers, who likes vaccination, who doesn't like vaccination? Let's talk about it. So interestingly enough, if you're in the NFL, you may get fired if you don't get vaccinated, or you may not even get recruited. Imagine that. All you got to do is take a shot in the arm, and if you don't, like the majority of people in the US who haven't gotten their vaccine, you may actually not even be recruitable to an NFL team. Where's that coming from? Coach got fired from the Vikings. Players may have to show proof of vaccination to play, and if you don't, you'll not only not play in the game, you may get cut, and you won't even get your fee or salary for that game. That sucks. Who cares about vaccination? I'll be fine. There's herd immunity. What do you mean the Delta variant? What do you mean the Beta variant? What do you mean the X variant? It's all malarkey. Well, so let's think about it. You don't get a vaccine, and if you get sick, what happens? Well, all the data shows that if you don't get a vaccine, you get sicker than if you have the vaccine. Is sicker a word? Yes, it is. More sick, sicker. So what's better? Get the vaccine and have a little bit of soreness or not? Well, there's a lot of data saying you can have bad outcomes by taking the vaccine. There's even some people saying that there's a microchip to actually track you when they give you the vaccine. I don't know about that. But let's assume that vaccines are bad. What do you mean vaccines are bad? Well, I say vaccines are bad. Well, do you have the evidence to support it? Well, maybe I do. Well, there was 44% of Americans have a vaccine. Well, that means 56% of Americans don't have a vaccine. No camera. Did you hear that? Good. So that means if 44% of Americans have a vaccine, doesn't that mean that if there was anything really terrible in high percentage volume, that we would have seen it by now? Well, we have. Oh, wait, no, this is the good side, this is the bad. Who's the good side? Who's the bad side? What side am I on? You don't have to get a vaccine. But it seems that the people that haven't got a vaccine are more likely to get a Delta variant, are more likely to end up in a hospital or in the ICU, even though the theoretical herd immunity is happening? Well, maybe not. You probably need 70 to 80% of the population to be vaccinated before you can truly get herd immunity, if that truly exists. And many scientists say it is, and who am I to disagree with a scientist, right? Case closed. Love that. Love that. So, in the end, vaccination, in terms of risk-benefit, let's think about the risks, let's think about the benefits. But wait, I say there's more risk and lower benefits. But wait, there's actually fewer risks and more benefits. Come on, people. It's really up to you. But it is interesting what's happening in the NFL.
If you were to look at the data and stuff, like, is there a reasonable risk that they are trying to avoid by not taking this?
Well, any vaccine has risks. For example, polio vaccine, mumps vaccine, rubella, TB. There's a lot of history in pandemics. There's a lot of history in disease in the past. Historically, people went along with what physicians and scientists said based on the best available evidence and data, and everyone had to get the polio vaccine. Antibiotics, when antibiotics came out, when polio vaccine came out, it was incredible. Yes. Could you get polio if you get the polio vaccine? There are rare instances that you can have side effects and risks associated with a vaccine. Could you get a fever, aches, chills with the vaccine? Hey, I was knocked out for 3 days after I got the Moderna vaccine. Second dose, not so bad. Did I get COVID? No. Did I get the Delta variant? I don't know. I got pretty sick recently. My COVID tests were negative, but it was kind of like a terrible fever and cold for 5 days. And then I got better. Did I have COVID? I don't know. Would I have been hospitalized if I hadn't had the vaccine? It's possible. See, and that's the challenge with preventative medicine. We are offering a vaccine to prevent a severe, debilitating, mortality augmenting disease. So if you don't get sick, you think, oh, I'm fine. However, if you do, that's bad. And there's a lot of data coming out from the South and certain states that a lot of people were against the vaccine. And now, subsequently with the Delta variant, now that their family members or themselves are getting sick with COVID and getting hospitalized, what are they doing? They're recanting their beliefs. They're actually questioning their politicized decision not to get the vaccine. And the other challenge is some of these risks and benefits are obviously politicized. And I'm not sure why they're being politicized. Rand Paul? So, risks, benefits. You decide. Just the facts, ma'am. Just the facts.
So other than just the possibility of getting COVID, like a lesser version of COVID if you have the vaccine, is there anything reasonable for people to be I'm assuming that the NFL players that aren't getting it, it's not because I might still get COVID.
Right.
There's got to be something else. I just can't
Sure.
figure out what the hell.
So my cameraman sometimes has a good idea. So he actually made an interesting comment. He says, well, what about other than COVID? Can you get something else? Well, interestingly enough, we're seeing a resurgence of RSV, respiratory syncytial virus. You've all heard of it. And there's going to be a ton of other viruses. Flu, RSV, all of those things. Okay, so what happens? So what happened when we sheltered in place? Which was a good thing, by the way. We restricted, we wore masks, we avoided this horrendous pandemic. Yes, we have some Delta variants come out, but we had a decent number of patients getting the vaccine. But now, the fuel of RSV and other viruses that didn't get a chance to get passed around in nurseries, elementary, and all these other schools, they're waiting to get active. So that's the risk that's now coming up, is just the ordinary flu and the RSV, along with variants of the coronavirus, together in totalitarian regime. No, sorry, I'm just kidding. Together could actually amplify the sickness and the pandemic and the disease. We're already seeing that in other countries. So, if anything, I'm actually a little more fearful of what the fall is going to bring. And I'm a pretty damn optimistic guy. Can I say damn? Is this CBS? No, it's not. I can say whatever I want, but it's a clean show. Strike that from the record. So, I'm worried about my kids. I'm worried about going back to school. I'm getting them to put their masks on. I mean, we went rock climbing, they had their masks on. Doesn't matter. I don't want them to get RSV, and my kids are too young to get the vaccine right now because they're under 12. So they're not vaccinated, but they're pretty durable kids, right? Kids are durable. They handle everything. My son survived a terrible RSV when he was a kid, like he was in the croup tent and all that. I don't want to see that happening to people, but that's what's happening to adults with coronavirus. They're ending up in the ICU. That's like the ICU is the adult version of the croup tent. Do you want to end up in a croup tent as an adult? I don't think so. I don't want to. I don't want my kids in a croup tent or in the ICU. That's what I'm worried about. And so my only thought is risks, benefit, your decision, but ultimately that decision may actually be influenced by someone else. So it may not be politics anymore. It'll be public health, public safety, and ultimately your employers and your insurance and the company you work for. You may not have a choice, but ultimately when it comes to humanity, do we really have a choice if we want to survive as the human race out of this pandemic? That's a big decision. And I know I'm going to end up with a bunch of negative comments. I am going to be shocked if someone doesn't slam me down below. Like, I know you guys are going to say all this crap about me. He doesn't know what he's talking about. Who is this guy? He's slamming this people and that people. Hey, man, it's okay. I can handle it. Say what you want. Just providing an interesting perspective. In fact, there was a recent lawsuit won by the company who demanded that their employees be vaccinated, and the company won. I'm sure it's going to end up in lawsuits. But that means that employers may actually start to take health seriously. After all, they are paying your health insurance bills. Speaking of health insurance, isn't hospitalization and ICU stay considered a benefit of your health insurance? So that means that if you get sick with COVID, the insurance company has to pay for your hospitalization and ICU stay as a covered benefit. Which means that if the insurance company decides that vaccination is required for you to maintain your benefits and health insurance, you may lose your health insurance if you're not vaccinated. Now, I'm sure there are actual medical reasons where you can't take a vaccination. You could be seriously ill already, or have a contraindication, or have an allergy to the products within the vaccine, and you're not able to, for medical, rational medical justification, not to get the vaccine, in which case maybe that's fine. But if you actually refuse to get a vaccination, an actuarial scientist, they're the actuaries that do the math for the insurance companies and determine the rate and ratio for benefits and coverage and whether it's group or individual policies, whatever it is. That's a separate conversation. I've got a blog on it. Go read it. However, if the insurance company decides not to cover you because you refused a vaccine, that could be interesting because in the end, the devil's hand may be forced and the details may become clear. Is that another way of saying the devil's in the details? Haha, I think so. So, employers like the NFL are requiring their employees to be vaccinated.
Not required.
Not required.
But they're putting so many things in there that it's.
But they're placing guardrails. Huge guardrails on how the players can actually play with or without the vaccine. It's very interesting. Now, I'm certainly not going to judge anyone. I have my own biases, and you've seen my blogs. Any of my judgments are typically opinions and sometimes mocking, sometimes humorous. But in the end, it's like healthcare. I can make recommendations, provide an opinion, but it's ultimately up to the patient to decide. I can provide clarity and objectivity of evidence and data, just like Dr. Fauci did to Rand Paul. Rand who? Rand Paul. Who? Case closed. So, in the end, NFL is interestingly affecting gameplay based on vaccination. Insurance companies may take the same route because ultimately, if it's going to cost you $1 million to cover you because you didn't get the vaccine, and the actuarial scientists have enough data to support the fact that not having the vaccine, or actually refusing the vaccine, can lead to more hospitalizations, more ICU stay, increased morbidity. Well, they don't care about mortality because that's life insurance, but maybe your life insurance won't cover you. Ooh. So, insurance product, maybe you can't drive anymore. Maybe you can't get life insurance anymore. Maybe every single insurance policy, payer, provider, and benefit will be dropped if you don't take the vaccine. That becomes interesting. So, I guess the question you have to ask yourself, is it worth the risk not getting the vaccine versus the benefits of getting the vaccine? Ultimately, it's up to you.